Truth Be Told podcast. My name is Erica and this is Brandy.
Hey, what's up, everybody?
If you're joining us for the first time, our podcast is focused on providing underserved and underprivileged communities, particularly communities of color, with the information and tools to improve their dental health care experience.
Mm-hmm.
All right, so we're going to be continuing on our restorative series. So for this week, we are going to discuss what are partial dentures.
Mm-hmm.
So I'm going to be asking you a few questions because I have a lot of questions. I remember when I was a kid, my grandparents had a little, like, it looked like the retainer cup, right?
Mm-hmm. Yeah.
Honestly, I used to be scared because I would go into the bathroom and I was a kid and I saw like this flat, because it looked kind of like a retainer, but I was in this cup and it would be floating. I guess they was doing, I don't know what they was doing with it, but I guess she'll tell me about that, right?
Yeah.
So I don't know. I just was scared. I was like, what is it?
Okay, so first, we're going to discuss what the partial dentures are. So partial dentures, they're a prosthesis that replaces one or more missing teeth. So if you're missing a tooth on the bottom and a tooth on the top, you'll need two separate prostheses. That's what they're called, but they are definitely retainer-like. And so you would wear those just like you would a retainer. If you've never had a retainer, they are removable. So they come in and they come out. They can be made of acrylic or they can be made of metal and acrylic for the teeth.
They can be made of metal?
Yes.
Okay. Is that
just like a retainer?
Okay. So, but the teeth part though, that part is metal. Like that's what you mean. But the actual teeth, because like the teeth hang down on there, right?
I'll put some pictures in there, and I will also I also have a video that I shot, which I'm going to probably reshoot, of what they look like. So I have some samples of them from work, and I'll post those to a post on the Instagram so you guys can see. But yeah, of course, the teeth are not metal because you want them to look like natural teeth. But the part that holds them in place can be metal or acrylic, depending on, just what your preference is or what the doctor recommends.
Okay. Question number 2 I have. Why do dentists recommend partial dentures?
Well, number one, to replace missing teeth. So, if somebody doesn't want to have implants, which are very costly, this is a more economically friendly replacement for teeth. It's functional and it serves the purpose. So, I will talk about the pros and cons, but that's, the main reason that a dentist would recommend a partial is to replace whatever missing teeth that you have, as long as you have some teeth that are healthy and viable that you're going to keep, because the partial denture can only work if you're going to keep any teeth, because it's going to clip on or snap on to those teeth that are left.
So what's the difference between this and this is an off script thing? This is in my head. I'm thinking, what's the difference between this and a bridge?
A bridge is not removable.
Got it. No,
the bridge is cemented into place.
Mm-hmm. All right. Okay. So what's the process?
Okay. So the first thing is you have to have an exam or a consultation from the dentist so they can determine whether or not you're a candidate for a partial denture and not some other restorative work like Erica was saying, a bridge. So we rule out whether or not you can get a bridge. A bridge will most likely only replace one tooth, maybe 2 or 3, but that's it. And it's within one arch. So a bridge will be either on your top arch or your bottom arch. For the partial, it can span the entire arch and it will replace many teeth in some cases. So it can replace 1 tooth, it can replace 5 teeth, and it can replace teeth on both sides of the arch, as opposed to a bridge, which cannot do that. So you'll have a consultation to see whether or not you're a candidate. And then once it's decided you're a candidate, you'll have to do things prior to that. But what you do to prepare is you have to make sure that your anchor teeth, which are the teeth that are left in your mouth, the teeth that are healthy, that they're restored. So if there's any decay, if there's any periodontal disease or any infection, all of that has to be addressed before you can start to move forward with making the partial denture. Because those teeth are going to anchor that partial in place. So they have to be as healthy and as strong as possible. So if you need fillings, if you need scalings and root planings, if you have periodontal disease, if you have any infection, or if there's any teeth inside your mouth that are broken or damaged that need to be removed, that needs to happen prior to starting this procedure. Just so you understand. And then once the consultation is set, your teeth are all healthy and ready to go. You'll have impressions or molds taken of your teeth so that those molds can be sent to the lab. The lab will then fabricate or make a kind of a temporary denture. It's called a wax try-in, and the denture is set up on wax so that it can be tried in to make sure it fits, to make sure the color is good, because we'll pick a shade for your teeth. And we'll also pick a shade for your gums so that the gums match. So if you have melanin in your gums, if they're dark, these prostheses will match your actual gum tissue and the color of your teeth. All that's decided before the wax try-in. The wax try-in goes in, any adjustments are made, it's sent back to the lab for the final partial. And then once the final partial is in, you'll get it in, it'll be delivered to you, adjustments will be made.
So in regards to the skin tone, remember we had talked about a while ago and a couple episodes ago about the changing of the color of the gums. So I guess if you want your partial to be a different color, I guess you got to bleach your gums to get that same color.
Well, I mean, that would be done prior to. So whatever you're going to do beforehand, you'll do. Just like if you want to lighten your teeth, if you want to whiten your teeth, you're going to do that before you pick any shade, because you can't whiten the denture. So once that's done, that's done. So yeah, like if you were going to do something like that, it would have to be beforehand and then matched to what you have inside your mouth.
Because then you'd be Jack looking like gums looking different, teeth color looking different.
And I'm it happens to people all the time.
I'm sure.
Yeah.
Okay. And so what's the timeline or to start to finish?
All right. So it usually takes about 8 weeks. So a couple months before you get it. So it's not a quick process because there's a lot of going back and forth to the lab and making sure that everything is fitting well and that the impressions were done well. Everything's good. So it takes a little bit of time. And then once you get them, there's like a little bit of a adjustment period. So you may have to come back several times to have them adjusted so that they fit well and so that you can use them functionally. You can chew with them and such. So yeah, it can take about 8 weeks or so from start to finish.
Well, thank you so much for giving us all the great information as always. So what we're going to do is there's additional information and we're going to take care of all of that on the second part of this episode of Partial Dentures. So again, check us out so we can finish up with that. You want to watch our episodes, make sure you go to our website, tootbetoldpodcast.com. It has all the links to all of our socials. And we will see you next time. Brandy?
Yes, that's it. We'll see you guys next time. Take care.
Bye.